Hi dear students, so this is a video lecture regarding glycogen storage disorders. Guys, glycogen storage disorders are classified based on their enzyme deficiency, right? So we'll be talking around 7 glycogen storage disorders. Fine, so let's start. The first is the glycogen storage disease 0. So guys, 0 means what? The name of the enzyme which is deficient here is glycogen synthase. So guys, if there is no glycogen synthase, what will happen? There will be nil amount of glycogen in the liver. It is not formed, right? So what will happen to the investigation part? If you see, there will be hyperglycemia after consumption of food, right? Because liver is unable to clear the blood right? Because it is unable to remove the glucose, right, and store as glycogen. So there will be more amount of glucose in the blood for long time, right? Insulin will be helping, but the liver is not helping here. Fine. So how will you identify the type 0 glycogen storage disease? By two things. Postprandial means after the food, postprandial hyperglycemia and nil amount of glycogen in the liver, isn't it? Now also you can identify these patients by fasting hypoglycemia, right? Because there is no glycogen in the liver, so whenever they fast, even for 1 hour, 2 hours, 3 hours, not 1 hour but 2 or 3 hours, there will be no blood sugar, right, released from liver. So there will be hypoglycemia. So this line can be important, that patient's liver had nil amount of glycogen present. So this is the unique line that you should remember. And postprandial hyperglycemia also. So guys, that is type 0 glycogen storage disease. Now we have the type 1 glycogen storage disease. So guys, type 1 glycogen storage disease is called as von Gerke's disease. Now guys, von Gerke's disease is caused by the deficient enzyme, that is glucose 6-phosphatase. Glucose 6-phosphatase is the enzyme which is absent in muscles already. Only liver has glucose 6-phosphatase. So muscles are not affected in this disease, right? So muscles are not affected. So if you see any question where the patient is presenting with muscle weakness, you can say that this is not the case of von Gerke's disease. Why? Because von Gerke's disease never affects muscles, because the name of the enzyme which is deficient is of the liver, that is glucose 6-phosphatase. So what happens next? If the glucose 6-phosphatase is missing, so guys, which two pathways will be affected? As I told you, glucose 6-phosphatase is the common enzyme of two pathways. The last step of gluconeogenesis and the last step of glycogenolysis. As we know that these are the only two pathways which maintains our blood sugar. So what will happen to this patient? Severe hypoglycemia in the fasting. So guys, that is why the treatment of this patient is nothing but to avoid any kind of fasting. Feed this baby every 2 to 3 hours. That is the only treatment available, right? Even in the night, the baby has to be fed. Fine. Because the glucose 6-phosphatase is missing, there is increase in the amount of glucose 6-phosphate. So this is our second point. So first was the fasting hypoglycemia because glucose 6-phosphatase is missing. Now the second is that because the glucose 6-phosphatase is missing, there will be high amount of what? Glucose 6-phosphate. So guys, what happens to this glucose 6-phosphate? The three fates are possible for this glucose 6-phosphate. Number one, this glucose 6-phosphate will be used in the HMP shunt pathway, and guys, this will result in the production of the ribose sugar, that is ribose 5-phosphate, and this will enter or activate the purine synthetic pathway. This will produce unnecessary purine nucleotides which will be degraded to uric acid. So guys, what happens?